Hearing aids, more accessible, more affordable. That's good for you, that's good for me, and I'm going to explain why. The FDA has just released their ruling for the Over-the-Counter Hearing Aid Act. After years of waiting, the public finally has the details of what we can expect. And over the next few months, leading into October 2022, there's going to be a lot of changes in the hearing aid industry because in October, there's going to be a new class of hearing aids called over-the-counter hearing aids. They're going to have to follow regulations and rules to make sure they have a quality of product and to make sure that they're following certain guidelines around who can use these products. My name is Dr. Ben Thompson. I'm an audiologist that has spent most of my professional career in San Francisco, California, studying at UCSF Hospital, and eventually starting an online telehealth company focusing on tinnitus, ringing in the ears, and hearing loss. Our company is called Treble Health, and we have experience working with different hearing aids in the online space. That becomes quite relevant given that over-the-counter hearing aids most often won't be purchased in person over a counter. Most often, they'll be purchased online. And it really has our industry watching because we want to know, does this mean more people like you who need help with hearing aids would purchase the devices and start using them to hear their family and friends, to hear speech clarity earlier? Does this mean that someone who previously said no to $5,000 hearing aids waited 5 or 6 years? Does this mean that that same person would start the process earlier because devices are around $1,000? We will find out. That's the beauty here with what's to come. Let's read a few snippets of the FDA news release on the screen. FDA finalizes historic rule enabling access to over-the-counter hearing aids for millions of Americans. More affordable hearing aids could be in stores as soon as mid-October. On August 16th, the U.S. Food and Drug Administration issued a final rule to improve access to hearing aids, which may in turn lower costs for millions of Americans. This action establishes a new category of over-the-counter hearing aids, enabling consumers with perceived mild to moderate hearing impairment to purchase hearing aids directly from stores or online retailers without the need for a medical exam, prescription, or a fitting adjustment by an audiologist. The rule is expected to lower the cost of hearing aids. It is designed to assure the safety and effectiveness of OTC hearing aids while fostering innovation and competition in the hearing aid technology marketplace. The OTC category established in this final rule applies to certain air conduction hearing aids intended for people 18 years or older who have perceived mild to moderate hearing impairment. Our team of audiologists met and we had some discussion around the impact of this ruling. Overall, we're in support of the Over-the-Counter Hearing Aid Act, and there's some important pieces that you, who may have tinnitus, ringing in the ears, who may have hearing loss, need to know. I'm going to cover 4 main points, starting with number 1. Over-the-counter hearing aids increase affordability and accessibility to healthcare. At Treble Health, we support that. We are on the same mission. This is a good thing for adults with hearing loss. Number 2. Over-the-counter hearing aids will not work for every patient. That could be it's hard to figure out how to use them. That could be they don't sound good because you're not programming them properly. Through the self-fitting process, there could be errors. We strongly recommend a professional consultation to talk to an expert to understand what kind of hearing aid will work for you, which ones should you definitely avoid, and having a few options so you can make an informed decision, that is highly recommended. Additionally, having an in-person hearing test to rule out any medical problems is still a good idea. So if I was you, or if you were someone in my family, I would recommend that you talk to an expert audiologist and you get an in-person hearing test. At Treble Health, we have an audiology team that fortunately has a telehealth service where someone can reach out to us and have a free consultation to ask us questions. What kind of hearing aids are right for me? Here's the situations I'm struggling in. I can't hear my wife. I'm having a hard time at work. Soft voices are not so clear. This is the budget I'm looking for. This is the hope that I have from getting these devices. And then we help that individual make a decision. Number 3, even though the over-the-counter hearing aid ruling created a benchmark of quality of devices, for various reasons, some of the technology will be far superior to others. And if you think that buying the cheapest over-the-counter hearing aid is going to solve your problem, you may be disappointed, you may be wasting money, and more importantly, you may be wasting time that you otherwise could have been hearing the people around you with ease. At Treble Health, we highly recommend that you research your different options from trusted, independent sources. Not someone who has an incentive to sell you just one product, but an independent professional who understands the whole market that can customize a recommendation for you. That is what you owe yourself, because if you do that right, you won't make a bad decision and you'll be hearing better quickly. Point number 4, this is very important for our community who struggles with tinnitus. That's something that we are very passionate about at Treble Health, and it's been one of our main focuses. Why is that? Because tinnitus is an underserved population. There's many audiologists, many ENT doctors who don't want to touch a tinnitus patient with a 10-foot pole. Now, God bless them. That's mainly because they don't have the experience or the desire to work with this sometimes challenging condition, sometimes a condition that requires more time, more focus, and quite honestly, engages with someone in a very vulnerable place, sometimes where they're really struggling. For the individual who has tinnitus, sound therapy is an important form of your treatment plan. Those of you who study your options for sound therapy treatment have probably come across the option for tinnitus maskers or hearing aids. Here's a very important point. Most over-the-counter hearing aids will not have tinnitus masking features inside of them. Most over-the-counter hearing aids are not designed for tinnitus, nor are they programmed by a tinnitus specialist based on your hearing profile, what kind of sounds work for you, and your needs. All that to say, do not think that buying over-the-counter hearing aids is the right decision for tinnitus. For example, you could buy cheap hearing aids at Costco right now. You don't need to wait for over-the-counter hearing aids. Those devices do not do that great for tinnitus because they typically do not have the inboard tinnitus masking features that we know are so important that drive the treatment effect for tinnitus. All this to say, from what I can see at this point, and I will monitor this as these new devices come into the market, there is still a gap in the tinnitus care and the tinnitus features in these kinds of online do-it-yourself hearing aids. So if you want to get tinnitus right and follow this treatment plan using medical devices like tinnitus maskers, the ones that we use at Treble Health, from the leading manufacturer of hearing aids in the world, programmed for you, done via telehealth, that is the better approach for you if you have tinnitus. Fortunately, in the telehealth model that we work in, the cost is about 40% lower than going in person. You might be tempted for more affordable options like over-the-counter hearing aids, but I really need you to understand those will not do that much for your tinnitus. Hearing aids alone do have a benefit for tinnitus, but when you get the devices programmed specifically for tinnitus by an expert like those on our team that we have vetted and have detailed protocols for how to program these devices, those are the individuals who do best. So I needed to make that public service announcement for our community not to jump straight into over-the-counter hearing aids. Ask a professional. If we think it could work for you, we will tell you, even if that means you're not doing business with us. That goes for me as well as other trusted tinnitus professionals. We ultimately want you to succeed and we want you to be educated about your options, but choosing the cheaper option and leaving some improvement or benefit on the table is not an advised decision. And that's something you should really consult with an expert that you're working with, preferably an audiologist who specializes in tinnitus. That's what our team provides. That's the ethos of our company. Be helpful, to serve, to provide the best care possible via telehealth, and ultimately giving you the outcome that you deserve. If you're watching this video and you haven't reached out to our team for a telehealth consultation about your case, whether that's for tinnitus, whether that's for hearing loss, whether that's to talk about options for hearing aids or tinnitus maskers, please follow the link below this video. You can have a free Zoom consultation to have your questions answered and ask someone like myself or one of my team members some really specific questions to your case. Hope to see you on that call. As we're wrapping up this video, I did want to mention something important. We had a major brand called Bose who has a good reputation for high quality audio. A number of years ago, they developed this online hearing aid that cost less than $1,000 for the pair. They had a period of time where they were selling them, marketing them. What we saw is that the company scaled back and restructured the project. Now, what I see is that they did it because the numbers coming in didn't look so good. For whatever reason, and I won't ever fully know why, they decided to scale back their operations and let go of some of their staff and restructure the Bose hearing aids. If it was going very well, if patients were succeeding, if they were selling a lot of units, if this was really a good fit, this online do-it-yourself model, it would have worked with Bose. I'm hopeful that other companies, like some of the big hearing aid manufacturers, Phonak, Oticon, etc., will have online direct-to-consumer hearing aids that are more affordable, that someone with a standard cookie cutter, mild to moderate hearing loss could use and benefit from. When those devices come out on this YouTube channel, we will review them to provide you the pros and cons, to keep you informed, to keep you in the know. That's what we care about. Treble Health will always be here as a reputable brand, an independent, trusted source as you learn about treatment for tinnitus and hearing loss. Please keep coming back to our YouTube channel here, as well as our website. And again, if you want a one-on-one consultation, you can have a Zoom consultation with one of our team members, and we will take it from there. Thank you so much for watching this video. My name is Dr. Ben Thompson, founder of Treble Health, here on YouTube, making these videos for you. Leave a comment below if you have any questions. Otherwise, I'll see you soon. Take care. Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.